Delaying gallbladder stone surgery after the pain starts is like driving around with the red engine light glowing on your car's dashboard. From the outside, the car looks fine. It's still moving. And you can keep telling yourself, all is well. The car is running anyway. But inside, the damage is silently building up. And if you ignore it for too long, the car doesn't just stop. It breaks down in the middle of the road and suddenly everything becomes urgent, stressful, and expensive. Gallstone symptoms start innocently enough. A little discomfort after a heavy meal. You blame the spice, the stress, or maybe just gas. Maybe it's nothing. And so you wait, assuming it will pass. And sometimes it does, until it doesn't. Because gallstones, especially the uncomplicated kind, which cause that occasional biliary colic type pain, have a habit of pretending to be harmless. They make you think you should wait, into rescheduling, into thinking it's not urgent. But here's a twist. Those stones, the ones that had already started causing trouble, they are not just sitting there, they are simmering. And if you wait too long, what could have been a clean elective procedure becomes a surgical emergency with complications that don't knock before entering. Hi, I'm Gaurav and you are watching Gut Instincts. Today's episode is about gallstones, not the ones causing fever, jaundice, or pancreatitis. We are talking about the simple ones causing some symptoms, the ones that just cause pain after a greasy meal. Today, we are not talking about gallstones that do not cause any symptoms. That was discussed in an earlier video. Do all gallstones need to be treated? Today, we will examine the potential downsides of putting off surgery for gallstones that haven't caused complications yet but are painful. Let's jump into today's session. You have had biliary colic, that classic upper abdominal pain after a fatty meal. No fever, no infection, no emergency. Just discomfort that comes and goes. So you wait or schedule surgery for next month or maybe next year. But here's what the data says. While waiting, 2 out of 3 patients suffer repeated attacks over many months. Up to 1 out of 3 patients end up back in the hospital with complications. Acute cholecystitis, which is a complication, can happen in nearly half of the delayed cases. Acute pancreatitis, which is an inflammation of the pancreas because of gallstones, can happen in up to 1 in 4 patients. Bile duct stones and cholangitis infection can occur in up to 8% of these patients. Gallbladder perforation, which is rare, but there is a different risk. It's like ignoring a small leak in your roof. One day it's a drip, the next day it's a waterfall. When you delay surgery, you don't just risk more pain, you risk a harder operation. Here's what happens. Inflamed tissues become sticky and difficult to dissect. Adhesions form, making laparoscopic surgery more complex. Conversion from keyhole to open surgery becomes a more likely possibility. Operative time and hospital stay both increase. Post-surgery complications go up, especially in patients who have had emergency readmissions. So what started as a clean elective procedure can turn into a surgical minefield. We have discussed this issue at length in our video. Is gallbladder stone surgery really simple? It's like trying to remove a splinter from your finger. Do it early when the skin is calm and clean and it slips out with barely a pinch. But wait a few days and the area swells, turns red, maybe even starts to ooze. Now that simple removal, it becomes painful, messy procedure and you are flinching before the knife even touches the skin. Now let's get clinical. After the gallstones have already started to cause pain, they develop a tendency to cause more trouble. They migrate, they irritate, they inflame. Here is what they can trigger. Acute calculus cholecystitis, which is the infection and inflammation of the gallbladder wall. Choledocholithiasis, which are stones slipping into the common bile duct causing obstruction and jaundice. Gallstone pancreatitis, when a stone blocks the pancreatic duct opening, causing inflammation of the pancreas. Cholangitis, which is a bacterial infection of the bile ducts, often life-threatening. Empyema and perforation, rare but devastating complication. All these complications of gallstones are discussed in greater detail in our previous video, what complications can gallstones cause. And once these complications set in, the surgical risk multiplies. As we discussed before, the anatomy distorts, the inflammation spreads, and the gallbladder becomes a battlefield. The overall cost of managing the complications discussed above can be alarmingly high. It is not just the patient who pays, the healthcare system does too. More visits to emergency, more scans, longer hospital stays, higher overall cost. Elective surgery is cleaner, faster, and more cost effective. Emergency surgery, it's expensive in every sense of the word. And there is always a risk of more complications after these difficult procedures, making this a vicious cycle. Most international expert reviews and guidelines now recommend early laparoscopic gallbladder removal surgery for all patients with symptomatic gallstones, unless there is a clear reason to delay. Why? Because early surgery, it reduces biliary complications, lowers emergency admissions, decreases major surgical risks and even mortality, and it improves the quality of life. In short, the sooner you act, the safer it gets. If you have any queries related to the timing of surgery, watch our previous video on the topic, gallstone surgery, why timing is everything. Gallstones start off as silent troublemakers. Many stay silent forever, but once the symptoms start, it's time to act. If you want to know the exact symptoms, watch our video What are the symptoms of gallstones. Delaying surgery for symptomatic stones might feel safe, even logical. I have been guilty of ignoring many of my symptoms for various problems until it's a little late. But ignoring something that we know would cause trouble eventually is not wise. The data shows the same thing. It's not just about pain, it's about pancreatitis, cholangitis, perforation, and a very different kind of risk and treatment. Like driving a car on ball tires to save a few thousand rupees on new tires. Feels fine on dry roads. Chalta hai. Then the rain starts, causing loss of control and it's a skid into the divider, followed by a 3 lakh rupee repair bill. And most alarmingly, the danger to life. That saving just turned into an expensive and dangerous trouble. The classic English proverb fits here perfectly. Don't be penny wise and pound foolish. So if you have had biliary colic type pain and your doctor tells you that it's due to gallstones, don't wait for the sequel. Because in gallbladder stone disease, the second act is rarely gentle. Here's my take on this. A symptomatic gallstone doesn't ask your permission to escalate. It just waits for you to underestimate it. Thanks for watching Gut Instincts. Stay curious, stay healthy, and don't let a tiny stone write the script of your health. Bye.